Hello, my name is Laura Baskall Smith from SLP Mommy of Apraxia and also the author of Overcoming Apraxia. I'm delighted to be here today to talk about childhood apraxia of speech in honor of Apraxia Awareness Day, which will be May 14th, and in honor of the whole month really, which is Apraxia Awareness Month in May. So, what is childhood apraxia of speech? Childhood apraxia of speech is a neurological disorder in which the child has difficulty planning and programming the movements needed for speech. Apraxia can range from mild to severe. A child with a mild case may have a lot of language, but just be have a lot of unintelligibility and find it difficult. Family finds it difficult to understand the child, to profound where the child has no expressive language capabilities or verbal speech. At what age does apraxia start showing signs? We have new research within the last 2 years that shows very early there are signs and symptoms of childhood apraxia of speech that early interventionists and parents should be aware of. So within the first 2 years of the child's life, there are limited vocalizations with little babbling history. By age 12 months, a child may lack a consonant sound. So these children might be cooing a lot or just speaking in vowels. By age 16 months, the use of fewer than 3 consonant sounds. And by age 2, use of fewer than 5 consonant sounds. Also by age 2, limited use of the posterior consonant sounds K and G. And in the first 2 years of life, favoritism of the stops P, B, D, T, and nasals M and N. Between 13 and 18 months, a child with apraxia might be using productions that are largely vowels with little use of other syllable shapes. Other things like limited babbling, a parent reporting that the child was a very quiet baby, groping for sounds, and other indicators could be characteristics of childhood apraxia of speech. Is apraxia connected to other neurological disorders like autism? Only in the sense that childhood apraxia of speech is also a childhood neurological disorder that is lifelong. So, and it frequently can occur with autism, although it may not. So really it's only related to autism in the sense that autism can be a comorbidity, but the two are not related in and of themselves. They are separate disorders. What is the difference between apraxia and dyspraxia? So childhood apraxia of speech, aka apraxia, is the difficulty with verbal speech sound production or planning and programming for the speech sound production. Dyspraxia is a term used largely in the United Kingdom for difficulties with gross and fine motor planning. So not really affecting the speech. It's called verbal dyspraxia there if speech is affected. Dyspraxia, though, is recognized internationally more so under the label developmental coordination disorder. And developmental coordination disorder, or dyspraxia, is another common comorbidity that can occur with childhood apraxia of speech. What are available courses of treatment for apraxia? So apraxia needs to be treated using the principles of motor learning. In the research, we have some good evidence now for some approaches that do use and incorporate principles of motor learning, and these include DTTC, dynamic, temporal, tactile cueing, prompt, rest, and others. And does a person outgrow apraxia? We wouldn't consider an individual outgrowing their apraxia. It is a lifelong neurological disorder. However, children can and do improve with proper treatment to the point that they might be said that they are resolved or resolving or have overcome it. However, numerous adult panels that I've done now talking to individuals with who have grown up with childhood apraxia speech, all of them recognize an internal struggle within themselves that we might not see externally with word finding, processing time to get their words out, things like that. So even though an individual might not be presenting with anything that looks like apraxia on the outside, it is a lifelong neurological disorder, and the individual will have that through their lifespan, even if they sound perfectly intelligible. Finally, what would be my message to moms with children having this condition, and how can they be more focused and trained to uplift their children more successfully? So my advice to moms with children is to remember that you are the expert on your child, and you will encounter many experts in their life, and just know that your input is just as valuable as the professionals. The other thing I would caution is that apraxia is still unfortunately not well known within the professional community, and even speech language pathologists who think they know how to treat it might actually not. We aren't really in graduate school given great coursework on childhood apraxia speech, and so likely to treat the disorder, a speech language pathologist would likely needed to have obtained some education postgraduate to get trained in how to diagnose and treat apraxia. So make sure that you ask questions. Don't be afraid to ask questions. Don't be afraid to advocate. It is your child and it is important. And how can mothers or parents and caregivers be more focused and trained to uplift their children? I just would recommend that you find your tribe, find a group. There's lots of groups on Facebook for families who have children with apraxia. Find a community, and in those communities, that's where we lift each other up. Certainly in my community, SLP Mommy of Apraxia, that is my message, and that is what I try to do and impart to my followers. Apraxia is a marathon, not a sprint, but we are in it together, and with proper treatment, kids do get better, and it is possible to have resolved apraxia and to overcome their apraxia. And even if they are not able to, and they still have struggles throughout the lifespan, it's still going to be okay. We have so many adults that are inspiring now on social media. Jordan from Fighting for My Voice, My Life with Verbal Dyspraxia is his handle. Follow him. He's very uplifting. His messages are always positive and have a positive spin, and it is possible to be happy and successful. And I would try to impart to mothers not to get so focused on what's going wrong, but to celebrate everything that will be going right when you get them the right treatment, when they say a word that they had a hard time with, when they acquire more sounds or targets. So focus on the positives. If you have any other questions, feel free to follow me on Instagram or Facebook, SLP Mommy of Apraxia. I have a website under that name, and feel free to check out my book on Amazon, Overcoming Apraxia, which details my life with my daughter Ashlyn and our journey, our marathon journey, overcoming apraxia, as well as resources and professional definitions for parents, to access. So thank you for having me.